Welcome to McMaster Minds, a podcast brought to you by McMaster University's undergraduate psychiatry program. This podcast will explore psychiatry training and the path to getting there through honest conversations with residents and staff. We hope this gives you a sense about the life of a psychiatry resident and staff psychiatrist, and that it helps you make the decision about whether psychiatry, and hopefully McMaster, is right for you.
I'm your host, Kayla Mathai, and join me as I chat with Dr. Tia Vine, a current resident, about her training as a resident in psychiatry. Welcome to our podcast. Do you mind introducing yourself to our listeners?
Yeah, thank you for having me. I'm Tia. I'm one of the fourth-year psychiatry residents at McMaster, based at the Hamilton site. I went to medical school at McMaster in the Hamilton site as well, so I've been in the city a while now. And right now I'm doing my chronic care rotation on one of the inpatient schizophrenia units.
Do you have any particular special interests in psychiatry?
Yeah, I've enjoyed so many of my rotations, but I'm especially interested in psychotic disorders, so including early psychosis intervention and populations with severe and persistent mental illness like schizophrenia. So the chronic care rotation that I'm on right now has been really great. I also really like teaching and mentorship, so I've been one of the teaching chief residents for the past year and a half.
Thank you for sharing a little bit about yourself. As this is a day in the life, we were hoping to jump right in and have you tell our listeners about what a typical day might look like in a psychiatry resident.
For sure. So on my current chronic care rotation on the inpatient schizophrenia unit, we typically start with interdisciplinary rounds on the unit in the morning, which is at 8:45. And then after that, I'll touch base with my supervisor to plan for the day. Then I'll see all my assigned patients for assessments throughout the morning and early afternoon. So I'll usually see people alone or independently for follow-ups, and then supervised by my preceptor for new admissions to the unit so that they're meeting them as well. Throughout the day, we sometimes have meetings scheduled as well, so either with families or for discharge planning, for example. Then after seeing all my patients for the day, I'll review any updates or treatment plan changes with my preceptor before having time to complete documentations and notes later in the afternoon, which is really nice so that my work isn't spilling over into the evenings or weekends. And then my Wednesdays are a full academic day, so that starts with grand rounds in the morning, followed by seeing my psychotherapy patient and supervisor later in the morning, and then having academic sessions in the afternoon. So those are either in person with my cohort or virtually. And then because I'm writing my Royal College exam in a few months, I also have a reading elective component right now, which gives me Fridays designated for studying, which is really amazing. And then lastly, in my role as teaching chief, I lead teaching sessions for the psychiatry core clerks. That's about once a month. And then I have meetings related to the curriculum, program leadership, or like fun projects like this podcast kind of scattered in my schedule as well.
That's really interesting. And of course, everyone wonders about call. What does call typically look like for a junior versus a senior resident?
Yeah, so call expectations and schedules can vary a lot depending on the program and the specific site, but I can definitely speak to call at the Hamilton site at McMaster Psychiatry. So most of our call is in the psychiatric emergency services, where we do a mix of overnight shifts, which are on Mondays, Wednesdays, and Thursdays, and then shifts that end at 11 p.m. So that's for Tuesdays, Fridays, Saturdays, Sundays, and holidays. So they each kind of have their own pros and cons. For example, the shifts that go until 11 allow you to mostly stick to your regular sleep schedule, but the overnight shifts then give you a post-call day. So I personally like having the mix of the both. These are all in-house calls, and the call frequency is around 1 in 7 for juniors, so PGY 1 and 2, and then around 1 in 14 for seniors, which is PGY 3 to 5. And then seniors also have some additional call for inpatient psychiatric units, which is a different setup. It's home call, and it's for 4 weekend days throughout the year.
We've seen an increase in attention paid to the work-life balance and resident wellness in recent years. How have you found juggling the many responsibilities that come with residency?
It can definitely be a bit of a learning curve when starting residency to find the right balance of all the different responsibilities as well as your personal life. But I think it does get easier once you settle into residency. We're fortunate that our program is very supportive of wellness and work-life balance in general, and that the culture within the program is that this is a priority for most people. Of course, residency is still a really busy time, so there might be times where work-life balance is shifted more in one direction or another. So, for example, last winter, I was working on both my quality improvement project and my grand rounds presentation around the same time, so that took up more time than usual outside of work. But then on the flip side, over summer, I wasn't working on any additional program requirements, and I had over 4 weeks of vacation traveling in Europe, so it really all balances out over time, and overall, I think we do have a really good balance of work and life in the program.
How often do residents find time for social events outside of the hospital? And as a follow-up question, for you personally, how do you de-stress, relax, or decompress after a long day?
We are really lucky that we have some time that's protected by the program for us to actually incorporate kind of socializing either within our cohorts or within the whole resident body into our regular schedule. So for example, we have monthly residency association meetings during our academic half days. We have an annual wellness retreat, and then we have rotation selection days twice per year where we often have like a social component as part of those. And then speaking for my own cohort, we try to plan get-togethers outside of those as well, whether it's a hike or a little holiday party or something like that. As for de-stressing, I think day to day, I find it's most important just to stick to the basics that we often even can't counsel our patients about. So things like getting enough sleep, eating well, walking, going for a walk outside, or doing some exercise. And then I mostly enjoy spending my time outside work with my family and friends, and that's a really good way to relax and decompress as well.
That's amazing to hear. And what is your favorite part about psychiatry residency thus far?
I think my favorite part is all the great people that I get to work with day to day. In our program, we get to choose our own preceptors for our psychiatry rotation. So I've worked with lots of staff psychiatrists who spend a lot of time teaching and provide amazing supervision clinically and share a lot of the same kind of interests as I do, and are kind of role models for what I want my practice to look like in the future. And then we also have a lot of overlap with interdisciplinary team members, which I really enjoy. And then having medical students on rotation at the same time can also be really fun.
Well, Tia, we've just about come to the end of our time together today. We have just a few more questions before we wrap things up. For students who are still in the exploration phase, how can they tell if psychiatry might be a good fit for them?
This might be really different for different people, but I think paying attention to how you feel when you're on your psychiatry rotations is so important. So at the end of the day, are you feeling drained, or are you still thinking about some interesting cases that you saw? And at the end of the rotation, are you like glad it's finally done, or does it feel bittersweet? Maybe you're still curious about some of your patients, or wish you could stay on the rotation longer rather than going to your next one. And then I think the next step, if you are thinking you're interested in psychiatry, is to generally try to imagine yourself in the specialty day after day, long term, to see if it fits with what you want your life to look like and if you can see yourself doing this work.
What was it that first drew you to psychiatry?
Yeah, so even before medical school, I was really interested in mental health, and I did my undergraduate degree in neuroscience, so psychiatry was the perfect fit for my interests, kind of from the get-go. But my medical school rotations in psychiatry really confirmed how much I did like the clinical work with patients, but also showed me how great it is to work within the specialty. All the staff psychiatrists, residents, and the interdisciplinary team members that I worked with were consistently welcoming and supportive, and the variety and flexibility within psychiatry made it really appealing from a career perspective, which just kind of confirmed my choice.
Thank you for those insightful responses. What's one thing you wish you knew about psychiatry before starting residency? Is there anything that surprised you?
I wish I knew more about all the different practice types and settings within psychiatry, because even though I knew there was a lot of variety and flexibility within the field, I only got to try out a couple of different settings through my clerkship rotations, and obviously they were all still based at academic sites. And I've been surprised to learn more about other settings like community or rural care, and even as a PGY4, I sometimes still learn about a new type of practice that a staff psychiatrist is doing.
Thank you so much, Tia, for sharing your experiences and advice. It's always valuable to hear the real thought process behind choosing a specialty. Before we wrap up, do you have any final thoughts or parting advice for our listeners?
I might be biased, but I do really love being in psychiatry. And if I had to go back to any stage of medical school, I would 100% choose it again and would definitely recommend it to people that are interested in the area. But I'm just sending luck and best wishes to everyone that's going through clerkship right now, and especially people going through CARMS.
Thank you so much for joining us today, Tia. I'm sure our listeners appreciate your time, and I know that we certainly do. Thank you.